Hi, everybody. This is Robin Strong in here with another conversation, Health Dame. And I'm pretty much going insane with excitement because I haven't seen these three amazing people in, I think it's over a decade now, at least a decade. We all first connected over Disruptive Women in Healthcare. And Missy, you wrote the very first healthcare blog. You interviewed Matthew Holt when he had just started Health 2.0. And remind me, who did he start Health 2.0 with? The wonderful doctor. Oh my gosh.
Um, it, wasn't it Ina? What was her name?
Oh God, you guys remember?
Yes,
Yes. Oh
I
my
can't
God.
believe I can't think of
Too
it, but
much
yes,
time has gone by, but I don't want to give Matthew all the credit because there was
Indu
yeah,
Surveyor.
Indu.
Indu.
She's
Yes.
awesome.
Yes,
Incredible.
it's
Yes.
amazing.
Yeah,
And you wrote my first yes, you were the first contributor. So, and then all of us connected with Hallie Tecco and Rock Health and XX in Health Conference. So we have a lot of ground to cover. God knows what health version we're up to. It's not 2.0 anymore. I probably can't even
666.
count that, but yeah, 666, right? Exactly. So what we're going to do is start with each of you just a very brief introduction and a little bit about what you're doing. And then I have about 10,000 questions, and we're going to have what I think is going to be a really interesting conversation. So Missy, take it away.
Oh my.
What do
Well,
you do? Very
exciting.
briefly.
Well, I'm very, very excited to be here today and reconnect. It's been so much has transpired since we've all been together. And of course, I'm very excited to just connect with these other two powerhouse women as well, who I've known for years. So I'm Missy Krasner, and I've been in digital health and healthcare for about 36, 37 years now. Whew. And I started out my career mostly working in big tech. So I did the first tour at Google on the Google Health side when Eric Schmidt was CEO and Marissa Meyer was at Google, and we were
Oh
trying to
yeah.
do sort of consumer mediated personal health records like Gmail for your medical records. That was super fun. Did that for 7 years. And there's been several Google Health teams since me left, ended up going to Box, which, like OneDrive or Dropbox, like all of those sort of like file sharing tools. At the time, Box was kind of a darling in Silicon Valley, and the CEO, Aaron Levy, had a lot of Google people working for him. And he was going to go public, and they wanted to do something in healthcare and life sciences, like beyond just HIPAA compliant file sharing. So came on to lead the industries team there, went through the IPO. That was my first big tech IPO because I joined Google right after they IPO'd. And then from there, Amazon came knocking when they bought PillPock
Oh
Pharmacy, and then
yeah,
they were
yeah, yeah,
thinking
yeah.
about Amazon Pharmacy, Amazon Care, doing things with Alexa, making her HIPAA compliant. And so spent several years at Amazon. In between, I did a short tour in venture capital. I think that's probably where I met Lisa and Rebecca. I was at a firm called Morgan Thaler Ventures, which is a mixed fund. It's now called Campus Prime. I was around for Practice Fusion Series A,
Oh yeah.
the first sort of ambulatory EHRs that was cloud-based and had an ad revenue model. Then went to Doximity's Series B, which now has, public and sort of people refer to that as LinkedIn for doctors. That was very successful, and did a series of other investments there as well that I won't, go into, but those were the two early ones. And then I also did another tour recently in investments with Redesign Health, which was a venture studio out of New York that had its own venture fund. We were deploying anywhere from 2 to 4 million of capital into seed investments that we incubated. And so my job there was to help get those sort of new seeded companies up and running and be sort of a board member, help them fundraise, help them get their sort of first pilots and their first deals. And so I have departed from Redesign about a year and a half ago, and now I'm angel investing. I sit on 9 different sort of advisory and company boards. I work with digital health companies seed into Series A, and I have a couple that are a little bit more mature that are on the healthcare AI side. So that's what I'm up to. And I live in Southern California now. I've left the Bay Area. That's
Amazing. And then we have Dr. Rebecca Mitchell, and it's been a long time. You've done a lot of traveling, and I know that you've been all over the globe. I've been following some of them, but maybe it's been a while since you've been overseas. I don't know, but you've been very busy. So have at it.
Love
What
it.
have you
All
been
right.
up to?
Well, first of all, just so excited to be on this call with all of you. I mean, reflecting back to when we all met, I mean, all three of you for me were you were women that I aspired to be, like I grew up in my career. And so
Oh
just
my God, I think she just called us old.
no, no,
I
no.
love it
Or
though.
I was like very far behind back then. But really, I'm just really feel so grateful to be on this call together and have, been in a good relationship with all of you for the last couple decades. So currently, I'm one of the three co-founders and managing partner of a new early stage firm called Scrub Capital. I'll start there quickly
Love the name. Love the
backwards in
name.
time. Thank you. I got to share how the name happened because
Yeah,
I actually love
please.
this story. Scrubs, of course, are what clinicians, especially physicians, wear in inside healthcare systems, especially the OR. And one of our first events, we're a startup fund. So the first event was largely me just throwing out a call on social media, like, "Hey, clinicians, let's come crash JPM and specifically the cafe at the top, like at the Four Seasons." You all probably know the
So
cafe I'm
JP is
talking
the
about. It's one of the only
big
places you can
financial
actually like have a
conference in
seat.
January, right?
Yes.
JP Morgan. Okay.
Yes, yes. And so I just sort of sat down and tried to save a little space, thinking maybe a dozen people would show up. Like 80 clinicians came in,
Oh, wow.
completely took over the Four Seasons Cafe, and tons of them were wearing scrubs because they had just come off like overnight shifts or like popped out of the OR. And it was just this beautiful visual in the midst of otherwise like total like men in suits, right? And it was just like a really magical start to the whole community and the fund. So anyway, that's where the name and brand came from. But really, the core premise of it is quite simple. It's the people who are in the trenches practicing medicine, who know the science, as well as like the operators building the companies. Missy being a great example. We believe are the ones best placed to invest in and support companies, especially in their earliest stages. But we wanted to do it in such a way that took advantage of all that's great about angel syndicates, but kind of gave people more ability to pool their capital, better risk exposure, better access to thematic experts, maybe in an area they don't know about, but like their peer in a different part of medicine really knows a lot about. And on the founder side, our checks could actually stick around as the company scaled instead of
And
getting
are
wiped.
the health professionals in the scrubs MDs, or is it broader than that? Or nurses?
Broader,
Good.
very intentionally broader. We believe, look, I mean, believe that. So we'll go back into my background in a moment, but I wanted to start here because it's really,
Sure.
I feel like the natural culmination of so many of the things that I've had the great opportunity to learn and do alongside clinicians in my career. But feel very strongly that both in startups and on the cap table, you need the entire care team because we are building products and solutions that implicate the entire care team. And look, like I had a midwife for both of my births of my two children very intentionally because I looked at the data and I was like, great, like supervised midwife practices. I believe in that model. And so I just really believe in all those perspectives being appropriate for different
So to
problems.
Missy and
Believe,
Lisa,
I should
because they're
say.
shaking their heads a lot. So yeah.
Good. And so that's what I'm doing now, full time with two wonderful co-founders, Christina Farr and Dr. John Slotkin. But going way back, so I grew up in a really rural part of the United States, northern Wisconsin. I promise there's like a purpose to this this information I'm sharing, not just going back to the very beginnings. But I had two parents that were in healthcare and just saw up
Okay.
front since I was a kid their struggles in making a delivery system work that certainly was not built for healthcare, right? And like all the cliches of hospitals shutting down, lack of subspecialists, right? Public health being really stretched. Heard from them around the dinner table my entire childhood. We unfortunately lost two members of our family that lived in that area due to totally avoidable medical errors, amazing people working in an incredibly overburdened system. And also bizarrely, despite this kind of scenario for our healthcare access in that area, we were also one of the towns that had one of the first supercomputer companies based within it create computers. So there was this like
Okay.
strange mix of like tech and engineers, right, and product thinking also in the community. And so I was very, very interested from a very early age in how we could use technology and so many of the creative things I saw my parents doing with people and community programs, right? Not just the technology to solve for that gap and prevent other folks from losing family members and just generally struggling and accessing quality care. That brought me into global health. I built and ran a nonprofit for several years where we were doing micro grants and some kind of basic business training for individuals who had small startup ideas, particularly in sub-Saharan Africa and Southeast Asia, but really, largely with like a heavily public health bent. Came to really believe in the power of entrepreneurship through that experience. and then went to medical school out here in the Bay Area at UC San Francisco. I think this was around the time that I probably initially ran into
I think
Missy.
so.
I
Yep,
was just
yep,
amazed
yep,
by
yep.
her, and all the work that she was doing. And, Missy Rock Health was starting around that time. I had the real fortune to have a teeny tiny little like medical sort of advisor role at Doximity. So just got like a lot of exposure to people doing the work that I believed in for real. And I was I became totally bought in, not only to the progress they were making against really entrenched problems I cared about, but also more than anything, the cultural orientation that community was taking to solving for these issues. Like extremely collaborative, very diverse people with a seat at the table, thinking from first principles. There's no sacred cows, like in terms of what they were willing to try, as long as it was ultimately going to help patients in society. And that resonated with me so much because I'd experienced firsthand up close where I grew up and then in global health. Just the degree and scope of human suffering that exists in the world, like the the consequences of inaction. And I actually think often, especially in digital health, health IT, whatever we're calling it, we don't appropriately weight the consequences of inaction against the potential consequences of trying something new, which is a different, longer conversation. Um, so I finished medical school and decided that I wanted to become one of the best in the industry at designing and building products, particularly products that were going to close that gap between where people were in their day-to-day lives, in their home and in their communities, and their doctor's office and health systems, again, informed kind of by where I'd come from. And so I did that for about 15 years across a number of wonderful organizations, some that were started and totally failed. So, like Will Owen, have had the failure experience as much as I've had great experiences in some of these fancier logos I'll mention in a moment. But I got to work with Validic when they were partnering with Kaiser Permanente, rolling out some of the very first chronic care programs at scale. That program is now nationwide across all of the regions. So that was a whole team of people. Don't take individual credit for that, but a really powerful initial experience partnering with a whole integrated health system and their clinicians to design something really, really new and seeing what was possible when you paired the technology with real like workflow and appropriate like business model change on the client side. Joined Livongo fairly
Oh
early in
yeah,
their
yeah, yeah, yeah.
journey. Yeah, yes. I think Missy, you may have actually been a helpful person on my shoulder convincing me to say yes to that opportunity because I wasn't looking at the time. But was really with them as they were just starting to go into their growth phase. Initially ran the clinical platform, so thinking about how we delivered clinical outcomes, our programs, how we created tools for not only our coaching team but larger care teams to use, and was I think in I would say not only because I was good at that job, but also because I was sort of obnoxious, constantly wanting to think about the much larger program. Ended up getting promoted into running all of the product lines. And so it was my team's responsibility to launch the new chronic condition lines, help take them to other market segments. And so I did that through their IPO and then the huge acquisition by Teladoc. Lasted after that merger for about a year and a half. Happy to share some of those thoughts and stories. Yeah, so
I
like
think we
saw
need
up close.
drinks for that one. Okay.
Exactly. I can go grab a glass of wine. But did that for a year and a half and was running actually all of the product lines other than their D2C behavioral health programs at the time. So got the experience to serve, tens of millions of patients a year along the globe through those products. And they were spinning off, billions in revenue, regardless of
So
what the stock
just
price
sitting
was doing.
around doing
Total
nothing all
scale.
these years, huh? Okay.
Well, I
Taking
was
it
totally
easy.
burnt out after that. I could turn you around and show you my completely now like overgrown, overplanted garden, but I made an attempt to be
Amazing.
an urban farmer to like heal myself.
Ah,
Um, but a couple things. So a really important lesson I took from Livongo was you make far better products, you're far more commercially successful, not just in selling to clients, but in like reshaping the thinking of the industry when you have clinicians at the table, like from the leadership level all the way through the different functions in an organization. And a question we always get at Scrub, and I even got back then when intentionally, hiring for these folks or, talking about the incredible experience working with them was, well, aren't doctors in particular so, opposed to change and like set in their ways, yada, yada, like experts can't innovate. And my answer is consistently something magic happens when you sit those experts alongside people with other skills like product design, they're commercialization experts, they're engineers, and you select appropriately for people who think about their responsibility and like job in their career to bring about patient and human health versus like my career orientation is to do my work in a really specific way in which I was trained. And there were some back then. There are now hundreds, if not thousands. Like that culture is changing really, really fast. So it kind of gets to scrub and why it's the right time. Companies to sometimes hundreds if I'd been particularly saucy on social media.
Saucy.
So
Okay.
saucy. I tend to only post when I'm mad about something, which makes my posting very uneven. But when I do it, it gets tension. Um, and so it really like that was what led to Scrub Capital alongside my team.
Fantastic. Well, Saucy is a good intro to Lisa. So, who's actually, I love how you describe yourself as having a Rubik's Cube knowledge of healthcare because you've really gone broad and you've gone deep. So tell us how where you are today and what brought you there. And then we're going to
Thank
like
you.
really dive into some questions I have about the healthcare that we're all experiencing for better or worse today. So go for it,
Okay.
Lisa.
Well, it's great to see you all, friends, longtime, and colleagues. Um, my career started in tech originally, and that was back in the days when it all looked like the Flintstones. Pretty much, there was no real internet stuff back then. It was not that exciting. And I quickly realized I wasn't that into it. And I joined a healthcare startup, which was in the behavioral health area back when that wasn't yet cool. And we ended up growing that company to about 800 million in revenue and 35 million covered lives and a lot of capitated full risk programs covering mental health and substance abuse, all things that were ahead of their time, went away for a while and are surging back. Very interesting to watch. And I ran all of sales and marketing, all the product stuff, and a lot of the operations. That company went from when I joined. I had about 5 million in revenue, um, and it when I left it was 800 million in revenue, 3,500 employees. It had gone public to great success, and then it got acquired by Magellan, and
I
just a very
remember that
interesting ride to
actually.
see it
Yeah.
from beginning to end, like you guys have seen in other companies. I went from there. We had a model that was very much driven by it was very mission based. The mission was if you improve access and quality, cost reduction will follow. And it worked really well. And that company was very clinically driven and it was very successful in reducing costs for payers and employers. And it was heretical in that nobody thought about things that way back then. By definition, things that were better quality should cost more in healthcare. So we decided, being saucy as we were, to start a venture fund that was focused on that concept, that you could use this concept not just in behavioral health, but in all of health, that if you looked at things that really designed to improve quality and access, you could bring costs down across all of healthcare. So we started a fund called Silas Group. That was back in the late 90s, and I was there about 15 years investing. I invested in the very first company doing clinical decision support through algorithms called Active Health. She knows that company well. I invested in a company, the very, very first remote patient monitoring company, Health Hero, it was called.
Oh
Total
yeah,
disaster
yeah,
at
yeah,
the
yeah.
time,
We
ahead of its
don't
time.
memories.
Would have done well in this world. And numerous other things. We did health tech, we did medical devices, diagnostics.
Traditional medical, like FDA review, that sort of medical device.
Yeah, and yeah, real medical devices, interventional stuff, and also in services. Services was really our stronghold because back then, people believed you actually need human beings to run healthcare. Turns out it seems to still be true, but in any event, not everybody agrees. So I was there 15 years. I left there. I did consulting for a while, kind of like what Missy's doing now. And then I joined GE Ventures and I led their healthcare venture group for a bit until GE decided to get out of the venture business at that time, which was really a shame because I was a great fund with great people in it, most of whom have either gone on to phenomenal success elsewhere or retired. Um, I then went to Manat and was a partner there, and I built
So
up a
that's a
lot.
law firm, a big law
Well, it's a
firm.
law firm and a consulting firm. People don't
Consulting.
realize the consulting firm is as big as the law firm in many ways.
It's
Oh, I
very
didn't
well known.
realize that actually.
Huge.
I think of it as a
So I
big
was
law firm.
a
Big
consultant,
consulting.
but I also ran the full practice for digital health and for medical devices and for entrepreneurial organizations across the board, not just healthcare. So I got to have the pleasure of having both consultants and lawyers work for me, and I survived. So I did that for a while, but I missed being part of the day-to-day sort of venture and business world the way I had been. And so I ended up leaving and actually thinking I was going to run a company. I was talking to people about being CEO of a bunch of different companies, and I was headed in that direction. And out of left field came this opportunity to go to the Heart Association, where I had been involved as a consultant 10 years ago and helped them start their first venture fund. I'd actually met the CEO of the Heart Association, Nancy Brown, and Lee Shapiro, who I know you all know very well, who and the three of us joined the Qualcomm Life Board on the same day, and we
No.
got to be friends. And now here we are. I work for Nancy, and Lee is chairman of our board. Weird small world how the thing works. Anyways,
What are you
um,
doing there
so I
specifically?
run the Ventures Group,
Okay.
Heart Association Ventures. We have four venture funds. One is a medical device focused fund. Everything swirls around cardiology and brain health. So heart health and brain health. And
Brain
so
health too.
brain
Okay.
health
I
too.
did not
Yeah, a
know.
lot of people don't know
I
for
didn't know
some
that.
reason that the Heart Association is actually the Heart and Stroke Association, and that
Ah, that's why. Okay.
and we've gone much far beyond that to things that are the sort of the next level out in brain health and also things related to heart health like kidney, metabolic,
Mhm.
pregnancy related conditions, all different kinds of things. So we have a medical device fund. We have a women's heart and brain health fund
Well, that was
that
going to
also
be one of
invests
my
beyond heart
questions.
and brain health to the conditions that cause heart and brain problems. Um, we have a social impact fund that invests in social determinants of health type organizations. And then we have a venture studio that does company co-creation and creation in the same general vein. And then we
No
do
pun intended.
yeah, exactly. Yeah. Vein and arteries.
Yeah.
We so yeah, it's altogether about a $200 million platform at the moment and thinking about what some of our next programs will be. Along the way, I did a bunch of other stuff. I was always one of those, ADD people that couldn't sit still. So I started a blog called Venture Valkyrie that a lot of people know me as, which always cracks me up when I get called that. Um,
I still think of you that way sometimes.
yeah, I still write it, just not
I
It's
as
a
thought it was
huge
your
frequently.
last name for a
compliment.
while, if I'm honest. I was always like, oh yeah, Lisa, the like Lisa.
I teach at Berkeley and I have for years, like 17 years in the business school. I teach healthcare venture capital. And I run the investment committee for an Australian digital health focused fund and also still sit on the Manat Ventures
Okay.
investment committee. So I still do some other minor external activities.
What would
Um,
you
there you
guys
go.
say is the biggest difference from like 12 years ago with venture and investment? What's changed
What
in
is 12 years
that
ago? What is it now? 20
what?
2013. I'm thinking about the difference then.
Yeah, I mean, has anything changed? I can't imagine it hasn't because
Oh, I
healthcare
think a lot has changed.
itself
I mean,
has
my
changed.
comment is, first of all, digital health wasn't really a thing yet. It was an idea. Some people were into it, but it wasn't really, technology really wasn't core to most healthcare yet.
Okay.
Number one, except for like, claims payment and back office hospital automation. Number two, venture capital was much more of a small industry. You didn't have small funds popping up all over the place. You didn't have the giant mega funds either.
Okay.
Um, those are somewhat cyclical, both in both cases, but nevertheless, it was very much a smaller world, I think, on the venture side back then, especially in healthcare.
Yeah,
Um,
I would agree. I think like if you're looking at like 12, 15 years ago, digital health was not a term that was well understood. People would sort of think of it as health IT or
Right.
e-health, and it was very, software that sold into either payer, employer, broker, or provider was really given to either an enterprise team, or it was given to a team that was life sciences on the investor side. And so this was really a moment in time where as digital health became more of its own industry segment, and we got to see more and more companies that were IPOing. I mean, look, if you look at Omada and Hinge Health, I think it took Omada almost 14 years to IPO recently.
And for
That's a
those that don't know Omada,
Yep.
its line of business is.
Omada is a sort of a cardiometabolic company that's really sort of focused on prediabetes and diabetes, and it sells mostly into the employer space, but also and so interestingly enough, I think we've seen a whole sort of maturity of exits. I mean, Active Health, Lisa was a pioneer. I mean, Active Health was a very big exit to Aetna, and really sort of what I would call, disease management 2.0, really, pioneering that space with new tools. So I think there's just been a tremendous amount of, its own focus. I think with COVID, we saw a massive door opening because, everybody was like sort of running towards virtual. The whole entire sort of system broke down. And so you saw this like kind of massive digital health bubble that anything that was virtual first, digital app first, digital front door got sort of funded. And we had this sort of massive kind of valuation moment in time where, teams that had great track records that had built things before and were jumping into new ideas were getting funded with like no tech whatsoever, just on a concept in the team. And they were either delivering or not delivering. The whole concept of remote patient monitoring, very much what Validic, and Rebecca was pioneering in the early days. So, you've got two pioneers here that have had some interesting sort of train tracks that have set down. But, I failed to mention in my intro that I was at the first office for the National Coordinator of Health and Human Services back when David Brailer was there. I think, Robin, that's where also you and I met. That was the beginning of the HITECH Act and rewarding doctors for using, electronic health records rather than using manila folders and paper. Like, there's just been a massive sea change into data liquidity. We still haven't figured out interoperability, but we're a lot closer. And I think that's what sort of defined the digital health segment or the health IT segment. And so now you've either got investors that are looking at tech-enabled services, right? Like in behavioral health, in neurology, in primary care innovation. And you've got another group of investors that have come over from the technology side that are looking at AI and automation. And we have another big, massive bubble. And Lisa just wrote something very telling about, is AI the answer or not, recently in the blog. But there's a massive, 85% of all deals up in the first half of 2025 were all in AI. And there were, on average, 34 to 35 million at a seed and our Series A. So big AI bubble. A lot of my companies are in it. Thank God. And then the other piece I think that we're seeing that's this sort of new massive kind of elevation in funding is everything around sort of longevity living and like, where are we going with longevity? How do we extend life? How do we extend the quality of life? How do we think about, kind of a little bit of a D2C feel of concierge meets kind of, Web 3.0 and longevity. And there's a lot of interesting funding going on. And I personally believe, and then I'll get off my soapbox and pass it to my esteemed panel here. I think that just everything that's happening with our administration right now and the massive erosion of safety net, rural and Medicaid, like you're going to see all of that risk sharing go into consumers and in commercial models like commercial insurance. And we're going to all have to pick that up. And that's going to drive more people out to consumer and retail healthcare. And I think this whole longevity thing is a very interesting pull through. That's my two cents.
Yeah, one thing that happened during this time was Obamacare, right? So 30 million people who were uninsured became insured, and now they're about to become uninsured again.
Again, right.
Yeah, and we only can imagine what, chaos that will reap on the system. I also think in this last 12 or 15 years, it's become extraordinarily easy to start a company. It used to be hard to start a company. Now it's easy to start a company. It's still hard to build one. But anybody, can outsource all the basic functions of creating a company and have one tomorrow afternoon, including a pitch deck they built on ChatGPT. And it's too easy in some ways. There are too many companies proliferating in little nichey things in a way that didn't used to happen even that long ago, that recently, 13, 12, 15 years ago.
In terms, words matter, and all this talk about longevity, not everybody wants to, depending on their diseases, some people don't want to live a very long time. And in fact, you mentioned you had a midwife. I'm going to be interviewing a death doula in a couple of weeks, which is, a lot of people are talking about death and a meaningful death, which is just as important as a meaningful life and longevity and all of these issues. One question I have for the real companies that are investing, meaning not the small ones that are doing the just pitch decks on Chat GPT, and maybe they go on to do great things, who knows? But how decisions are being made, are they any different today than they were, say, 10, 20 years ago in terms of, I guess my specific question is, it's a marketplace. There needs to be a return on investment. That's obvious. But what happens when there's a skew in the marketplace? And what I'm speaking specifically about is, I think you guys know my husband Brian passed away a few months ago from Lewy body
Yeah.
dementia. Most people think of dementia as Alzheimer's. Um, and Lewy body is the second most common form of progressive dementia right after Alzheimer's, but most people don't know what that is.
Yeah.
They're not as familiar. And what happens is, including doctors, and Parkinson's is on the Lewy body dementia continuum. And
Mhm.
so anytime, and Brian had both diagnoses, and this is relevant because on his death certificate it said Parkinson's, and when he went into hospice it said Parkinson's because coverage and reimbursement are less of a hassle. They're both legal,
Mhm.
but they're less of a hassle. So the life science and other companies think the market is small, when in fact it's a huge market, but they're all the boring coding stuff that really counts and matters for a million reasons is misunderstood where decisions are being made. How it's very frustrating. How do we get the right information or correct for that?
Yeah.
What do you think with scrubs?
Well, I mean,
How do
maybe
you
I'll give an example that makes so first of all, Robin, I followed your family's journey and you're writing about it on Facebook so often. And I, I just want to say, like, thank you for sharing that with
Oh,
all of us in
sure. I
the
can't
world. Like,
stand
that was the real,
stigma and it makes
yeah,
me, anyway, that's going to be a whole different thing, but thank you. Yeah, because he was still Brian, even pretty
yeah.
much to the end. Yeah, despite it all. But anyway, I digress. Yeah.
Um, Maybe what I would share optimistically is there are many categories, particularly sort of condition areas where people said had the same pushback when a company came to market saying, look, this is a big market opportunity. We can actually intervene on like the quality and cost structure of this problem. One of the most more recent ones is actually in GI, right? You're
Hmm.
now seeing many companies getting funded in GI health, but it used to be that when, say, an employer looked at the costs related to particularly like chronic, GI conditions, it was so sliced up into so many like sort of sub conditions that in aggregate you didn't realize that it was a huge contributor to cost. And it really took companies like Oshi Health, which Scrub Capital invested in, Cylinder, some of the others I know Missy, you're involved with one to come in and say, no, you are looking at the data wrong. Let's help you look at the data correctly and then talk about how there's like a real viable path to changing these outcomes, for your employees and their families. So it is possible for smart people to, I think, make that argument. And there's good examples of where the market has
Yeah,
responded.
but you're totally right, Rebecca, I think, but also wrong because the problem you described, Robin, is one of miscoding on purpose. So you can never see the correct data.
Right.
And it's, another example or one of many examples of how we design healthcare to fit the
Yep.
billing system and not the healthcare, needs of
Not
people,
the reality of the
and we
system.
see it all the time. And,
It's
the
evolving.
adoption curve of products, if there's not coverage that doesn't get covered, even
Right.
if it's better, even if it prevents an expensive condition downstream because nobody will pay for something that takes 2 years to fix or prevent because they're not the ones on the hook for paying for the all the things that we've done to create a backwards, system that is designed around payment and not designed around health. And I think, is there a way to fix that? no, unless we start from scratch. I think you can only do it a little bit at a time here and there. But even if you can get the data aggregated in a way that makes sense, do you even know if the data is right? It's probably still deeply understated or misstated, but at least it's directionally correct.
Yeah.
Yeah, I mean, I think that's what your sort of blog that you put up here is that, that there's always going to be bias in even the large language models that we're using to build AI models because the bias inherently lives in the data. And so if most of healthcare is built around payment models and
Mhm.
insurance coverage, and even our clunky EHRs are really focused around billing as opposed to true clinical and documentation for health's sake. But that's always the sandbox that we're going to have to be playing in healthcare because that's
Yep.
just how our country has worked to deliver healthcare. And I think there are tremendous amount of innovations that will come if we do move towards more of a D2C model and we have to compete for direct dollars. If more and more people aren't insured and are stepping out of traditional insurance models and we're getting a lot more alternative health plan models, then you're going to have a totally different way of talking to consumers, providing care for consumers, because then it's going to be like, hey, you know, don't screw up my billing. This is the wrong diagnosis. And or it doesn't matter because I'm not in the insurance model.
Right.
So,
Right.
maybe that'll change with turning healthcare and insurance models on their head. We are seeing some interesting companies that are doing alternative payment models in insurance.
Uh-huh.
Health kind of started that trend long ago, but I think what's more interesting is sort of like it is kind of what Lisa's brought up, and Rebecca's looking at a ton of companies in this space through Scrub, but I think that AI is going to be very, very interesting as we move forward. I think that the biggest lift that we're going to see is just on the administrative side, you know, like all of the ridiculous workflow whether it's call center workflow, it's prior auth, it's HCC and risk coding or pop health sort of risk coding. There's just a lot of human stuff that we do today that can be augmented by AI, but I would pop it to Rebecca, who's on the clinical side. I still think there's a long way to go. And I worked at Amazon and I worked on Alexa and smart speakers, the first generation of this AI, which is now leapfrogged considerably. And I think healthcare is always going to be a high touch care model. Like you're always going to want to talk to a human. It's an emotional process that you're in when you're sick or a family member sick. You're always going to want a human in the loop. But if I can go faster, if I recently, I'll just pause with an anecdote. I recently was riding around my neighborhood, and as I do every single day on my bike, and got hit by a little kid on a motorcycle who was popping wheelies and fractured my wrist in multiple places. I dislocated my knee patella. I had a hematoma on my elbow. I actually have my wrist out of my cast and, have my stitches out just as of yesterday. And so I'm doing my PT as we speak. But the practice that I went to was fully AI enhanced. They had an ambient scribe doing all their ambient scribing. They had a startup that was in the front end of their AI call center. So every time I called, everything got meta tagged and routed. And that got routed into my billing. It got routed into my in basket on the EHR. It got routed into scheduling optimization. And I had a tremendous experience. I can't even tell you, it's been 32 days. I'm already out of the cast, had the surgery and in rehab, and everything's
Oh,
fully
you had
coordinated.
surgery. Oh my God.
Yeah, yeah, fully. Like, I'm already like
But
dressed
a
and
human being did the
I hope that
surgery,
kid's
right?
mowing your lawn for life.
yeah, yeah. And I'm telling you, it was a random referral that I landed in this fantastic ortho
Oh,
surgeon that, I live next to one of the biggest retirement 55 plus communities next to the villages in Florida. It's Leisure World here in Southern California. So anybody that's in a fee for service like ortho practice is just jamming because it's a volume game. And so what can you use on the front end to really get high skilled surgeons doing the important stuff and everybody else doing the sort of lower level stuff? Like I saw it firsthand and I was like, tell me all the startups you're using because I want to go talk to them. This was, as a consumer, a patient, an amazing experience, top to bottom, efficiency, every touch point. And that's hopefully where healthcare will be with the advent of AI, but still a long way to go on clinical decisions. I mean, Rebecca, you see tons and tons of stuff every day that's being pitched to you. I'm still a little suspicious of a diagnosis, a nurse or a care manager kind of helping me along, a registered dietitian who's a full AI bot. I even have some companies that are piloting that. I don't know where you're at on that, but
Yeah.
that's where I'm concerned.
Um, so I'll say a couple things. One of the things that I think we don't talk about enough that happened during COVID is that a bunch of insiders that were told change has to happen really slowly. We have to do certain things in person, only a fraction of things virtually, suddenly experienced that that was not true, right? That was not true. It was never true, right?
That's very
And
correct.
that was a huge part of what has made this fund scrub possible because now there's tons of insiders who believe that. And it's also led to a real like groundswell of clinicians who are now founders or inside these companies working alongside the founders. And the orientation is it is both what you are describing, Missy, and I've had several experiences like that myself, and they're absolutely phenomenal consumer experiences. And often the clinicians inside those organizations are much happier and do feel like they're practicing at the top of their ability. But what I'm observing that I find even more interesting, um, largely aided by this like group of now like very activated people, is a recognition that the system that we exist within, like yes, on the billing side, yes, on the regulatory side, but also in our definition of who does what and in what context, is also just like it's just a construct, right, for the business models and regulatory system people have been practicing in and training in for a long time. And so what I see a lot of that gets me excited and that gets, and of course I'm generalizing, gets the larger community, which there's now 900 amazing, amazing folks working with us excited.
Oh my God.
It's not this dichotomy between like keep the people as they are today and give them better tools. And it's also not get rid of people in medicine. Like, I, I mean, I think we will have changed completely as a species at the point that we're getting rid of people, right? In something as intimate and as scary and as important as medicine. But it's saying, what does it mean if we can bring together human and machine? And does that change the actual shape of different specialties and who does what, right?
Rebecca,
And that to me is going back to the first principles.
yeah, and of that, where you grew up in Wisconsin, rural Wisconsin, would these tools be possible? Like, is there an infrastructure? It used to be we worried about, broadband availability and things like that. And I mean, are we making us, and again, I did a lot of work on the consumer side, so I'm always worried about people
Yeah,
who are left out, with all of this. And
it's an
again, it
absolute
goes back to your inaction. We have to do something, and you want to move forward so we can get to that last mile and all of that.
It's an absolutely great question. I mean, I have some experience with it from only a few years ago because I was part of Homeward Health in their
Uh-huh.
first year, right? And they're specifically looking at, how to make care better, particularly primary care for older adults in rural America. And the answer is, no, the infrastructure is absolutely not fully there, but you can design for that reality and still make it a substantial improvement on status quo. So, we had things like a mobile unit that would move around. We bring people to people's homes, but we also, we're providing a lot of care virtually where people,
Hmm.
did have the bandwidth. And we were also doing, I should say, they now are doing even more, which is really exciting to support the clinicians who are in those regions in the ways, that Missy was describing earlier. So it's,
And
that is absolutely still a limitation.
I know
It's
our time.
interesting.
Oh, go ahead. Go
I would
ahead,
say it was
Lisa.
interesting. We just invested in a couple of companies that are doing virtual care remotely for places where, for categories that we care about, obviously, that, are super underserved, not
Hmm.
because necessarily they're rural or not rural, because there's no cardiologist there or
Yeah,
neurologist
sure.
there or whatever there
Sure.
may be. And so the wait times are 4 or 6 months to get a doctor's appointment.
And you're dead by
I do
then,
think, but what it's facilitated is access to people, and I think,
Yeah, isn't that Ina's new company or
yeah,
it's
yeah,
phenomenal. She's such a great founder.
yeah,
I'm so
it is.
thankful.
It's called Xera. It's a really interesting company. Anyways, I um, I just think there's a lot that can be done with technology to augment care. I just, worry that people get very sloppy and try to do things too fast and replace real care. And I
Yeah, but
just,
like
No.
Auxiliary is a great example of like
Mhm.
like I think of that as Uber. Like that's about finding people and putting them in the right pods into the right practices. And like when I think about Uber, they didn't like if you think about picking people up and or delivering food, that's not a new concept, right? It's just that they
Nope.
used the power of technology and even AI to essentially have a
In the
better
marketplace.
hub, right? And
Hmm.
it's very similar to what she's doing. Like she has figured out a better like pod, drop-in pod, right, to be fully
Hmm.
and integrated into the practice to go. And
Yep.
it seems it's so simple and elegant, right? It's like, well, we've been providing staffing for a really long time to either health systems or
Yeah.
practices.
Mhm.
But what's different about it? It's the technology that you can leverage today on training, credentialing, and logistics that makes us go way faster. And back to my original point, it's all about workflow automation and essentially going faster and being able to take out some of the repetitive tasks and some of the labor to get people like, whether it's, hey, I got to run more my practice more efficiently, or I need a cockpit of talent that's going to help me. I need a scribe talent, like whatever it is, right? We can do that much more efficiently now. And I think that's where digital health has made its inroads. I think Rebecca, you and I are both in some tech-enabled services. I've had a lot of behavioral health companies that I've been in. We're both in a GI company. I think that's about also being able to expand um, staffing models, right? Because, and it's great for practices that want to drive revenue, but like, whether you're a primary care practice and you have people coming in saying, hey, I need a behavioral health consult, and it's like, well, good luck. Here's the referral. Go figure it out.
Mhm.
About 3 to 6 months to figure out if you could find someone. Or, hey, I've got what feels like irritable bowel syndrome, and I can't get help, and I'm like crippled over, and I need a diet lifestyle assessment. Like, doc, help me. And everybody's like, I can't deal with this low acuity stuff. Like, I'm a surgeon, or I need to scope you. That's where I'm making my money. I think that these wraparound services that are
Mhm.
enhanced by technology are great, or if it's a new care model, it's primary care innovation, or it's, trying to introduce a value-based care contract in like, dementia or neurology like that. These are interesting things that I think can be supported by the new guide model. That's where I think tech-enabled services are still getting play. But, some
But
people,
I'll
oh, it's
take
all
issue
AI.
with
Yeah.
your Uber example. In general, it's correct, but in the specific, it's not because you don't create a trusted relationship with your Uber driver. You never see them again. And
This
so
is,
longitudinal relationship there doesn't matter.
yeah.
And number two, Uber's goal is to get rid of all the drivers and replace it with self-driving cars. So they're just taking a step towards that, with their automation.
Yeah.
And I don't think that's what Oxera or any of the similar companies would look to do. But I do agree there's opportunity to make things better because my personal experience dealing with the doctor lately was horrible,
Mhm.
Don't
making
get me
10,000 phone
started, that's
calls.
for
So
sure.
yeah, I gotcha.
Yeah, for
Anyways,
sure. And before I let you guys go, because I want to be respectful of your time, I can't not ask, where are we on whatever we're calling women's health? Are we seeing investments in women's health? Are we seeing women? I know you guys are involved, but there were very small percentages leading research teams, leading venture teams. And I'm also interested in young women. Is anything changing both in the venture space, who's besides you three? And then in what we call women's health, I know in stroke and heart and
Yeah.
some.
I mean,
Yeah.
Lisa, this is all sort of you because you've spent a lot of time here. But what I will say is clearly the current administration it's been very difficult around any kind of research, anything at NIH. I mean, I don't want to get highly political. I served in a Republican administration, but we have taken a huge leap backwards in women's health. However, there are still pockets of venture that are investing in women's health. I
good.
mean,
Well,
Joanna
we certainly
Margaret
are. I mean,
did,
but
yeah,
I think we're trying to help people understand that the health of women is their whole body.
yes,
Yes.
Sure.
It's different from the bikini. If you
yes,
look at what actually kills women and causes them the most morbidity, it's cardiology, heart attacks, heart health. It's, neurology. 75% of Alzheimer's and dementia cases are born by women. It's autoimmune disorders, 80% women. It's all of the other things. And it's also, even if it's gynecological, it's not just the having a healthy baby or getting pregnant part, it's the preeclampsia part, it's the
Yeah.
postpartum depression part. word. It's the things that are much more broad than the way people think about women's health. And so for us, we think about it in those very broad terms. I do think there's a lot. One thing that there is a lot more willingness for people to talk about it and raise these issues. People talking openly about menopause, people talking openly about fertility, all the things that used to be taboo. So that's the first step, is acknowledging that women exist. I think the second step is, we're in a moment in time where, forgetting the political part for a moment, which is, sometimes hard to do, the funding environment is really
Yeah.
terrible and for everything in a lot of
Right.
ways, except if it's AI for AI. And I think that while there are now many, many funds focused on women's health, not just our Go Red Fund, the ability of them to raise money in a very tough environment for all funds, much less specific funds, is hard. And they're mostly very young funds with mostly less experienced entrepreneurs or less experienced investors. And those are the hardest funds to raise, those very new ones. So, it's a confluence of events that are tough. It was great to see the Gates commitment to all that funding for research. Research is critical.
Right.
However, if it doesn't ever commercialize, then,
Right.
what good does it do us all? So I think, I hope we'll start to see a resurgence there, but it is a very tough time.
Yep.
Rebecca, any thoughts on like, are you seeing more women-led, pitches and requests for
So
funding?
we're so first of all, like enormous plus one to everything that Lisa said. Couldn't agree more. We are seeing a lot of women-led businesses at our firm, and a large number that are focused on issues of high interest to women, which I agree are absolutely not just limited to like the reproductive system. But
We
I
used to
think
call it
that's in part,
bikini health.
right?
Yeah.
It's not just bikini health, but I believe that's in part because two out of the three GPs at the firm are women, and we talk about these things all of the
Mhm.
time. And so
Hmm.
the stat that I was going to bring up is that unfortunately, in this contraction of venture capital, the progress we had made in companies led by women getting funded, firms started by women as solo or part of a larger GP getting funded, we've lost a lot of that ground. And I don't have the data yet, but I suspect there's going to be a downstream impact in these kinds of businesses getting supported.
Well, I don't want to end on a not exciting,
Sorry to be,
positive,
we're
upbeat.
investing
So
in them.
Here's
yes.
your upbeat note.
Yeah.
Over the
So
next
there it
20
is.
years, there's
And
going to be a
and a
massive
very
transfer of wealth to women.
okay.
Massive, unprecedented amount of wealth that's going to move from the hands of controlled by men to women
Mm,
through, just through trusts and transfer of wealth as states mature.
mm.
And I do, while that
Cool.
unfortunately probably won't affect my health trajectory, it will affect my daughters. And that's the one thing that gives me hope.
Oh yeah, 100%. And I'm going to be a grandma. So
Oh, how exciting!
very
Congratulations.
exciting.
Cute.
Yes, I can't believe it. But the last thing is I asked each of you to think about a song because I'm curating a Health Dame playlist. So that was the one thing up until Brian died we did every day as I made a new playlist because he was a big music guy and music and the brain is a big thing. In fact, my first interview was with Dr. Connie Tomino, who I was on her board with Oliver Sacks. I got to meet Oliver Sacks and
Yeah, yeah.
very cool. So every interview, I ask someone, and if you don't have it off the top of your head, you can email. It can either be your favorite song or something that relates to your work. So, who wants to
All
go
right,
first?
I'll do mine because mine's the same answer every time I get asked this. So mine is "We Are Family," and that is the Sister Sledges version,
Yeah,
the original. Because as I think about healthcare and my work and what I care about, it's all about, hey, if you think about healthcare, public health, you think about sort of why we're all doing this 20 hours a day, it's because we're trying to actually lift the health of our family. That's what
love
I
it.
do, as a caregiver.
That
Love
was
it.
very inspirational. Mine is bad to the bone because that's how I want myself and my friends to be remembered.
I'm so glad I'm your friend. Yeah, very okay. Okay, Rebecca, bring us home.
So I was going to be honest in answering this because your question was framed also as like, what are you listening to all the time lately? And I will
Yeah.
like, our family is listening to a lot of Enya because I have a kindergartner starting kindergarten, I have
Oh
a middle
yeah.
schooler starting. My husband and I are both entrepreneurs, and like we need that at bedtime every night. But the way that I will tie it back to the larger world is just to recognize that like Missy, Lisa, Robin, everyone, like we are doing this hard work in what is also, in a larger sense, a very difficult time in many ways. And we all just need to take care of
I love
ourselves.
it. These are
Acknowledge that.
amazing. And you guys
Definitely.
are amazing.
And,
And thank, thank you for spending time. I know you're really busy and it's just, I could talk for hours. And I hope when you get to DC, you'll let me know. And if I get to the West Coast, I will let you guys know. And let's stay in touch more than once every decade because
That
it's,
sounds
you're
good.
doing really, really cool stuff. So thank you. It was wonderful to
Thanks
spend
for the
time with
opportunity
you.
to see you and
great
everybody
seeing you,
else.
fun. So
Thank
so
you.
fun.
Bye.
Bye, guys.